My name is Ed Hickey, and I serve as Vice President of the American Association of Kidney Patients and Chair of our Veterans Health Initiative. On behalf of AAKP, thank you for allowing us to once again be part of your annual conference. AAKP is the oldest and largest independent kidney patient organization in the United States, founded in 1969 by patients for patients. In fact, it was one of our board members, Shep Glazer, who dialyzed in front of the House Ways and Means Committee to help pass the Medicare ESRD program that has saved more than 1 million lives since 1973. Since that time, we continued our mission to improve the lives and long-term outcomes of kidney patients through education, advocacy, patient engagement, the fostering of patient communities, and support of research and innovation. AAKP works closely with a number of healthcare professional organizations, such as the Renal Physicians Association, and greatly respects those attending this meeting in the important role you play in the lives of kidney patients, those on dialysis, and transplant recipients. With that, I am very pleased to recognize one of your own with the 2022 AAKP Medal of Excellence Award, the association's highest honor for healthcare professionals, which recognizes individuals who are committed to improving and extending the lives of all kidney patients through advocacy, research, technology, and quality-driven treatments that protect patient dignity and fully align with patient aspirations. This prestigious award program recognizes individuals across the healthcare team, and it is my distinct honor to award the 2022 AAKP Medal of Excellence in the physician category to Dr. William Fissell. William H. Fissell IV is a physician scientist who has devoted his entire career to patient care and translational research in renal disease. He built on his engineering training at Case Western Reserve University, where he earned an MD, and then completed postgraduate training in internal medicine at University Hospitals of Cleveland in the Louis B. Stokes Cleveland Veterans Administration Hospital. Dr. Fissell then moved to the University of Michigan, Ann Arbor for his fellowship in nephrology, where he trained with Dr. H. David Humes, developer of the first bioartificial kidney used in clinical trials. Dr. Fissell is an associate professor of clinical medicine at Vanderbilt University Medical Center. Before moving to Vanderbilt in the fall of 2012, he was a director of renal technology laboratory at the Cleveland Clinic in Cleveland, Ohio, where he pioneered work in the application of silicon nanotechnology to hemodialysis and hemofiltration. Dr. Fissell serves as the medical director for the Kidney Project, a key innovation that aims to create a bioartificial kidney as a permanent solution to kidney failure. In 2018, AAKP initiated a partnership with the Kidney Project and has supported their efforts under Dr. Fissell to create an exciting and innovative solution for kidney disease. Dr. Fissell has graciously presented on the Kidney Project to AAKP audiences during our annual Global Innovation Summit and also during our national patient meetings over the past several years. His work provides hope to kidney patients who may not be eligible to receive a kidney transplant, and I am very pleased to present AAKP's Medal of Excellence Award in the physician category to our very good friend, William Fissell. Bill, congratulations, and I invite you to say a few words.
Hello, I'm Bill Fissell. I'm a nephrologist, an engineer, an associate professor of medicine at Vanderbilt University Medical Center in Nashville, Tennessee. It's an honor and a privilege to receive AAKP's Medal of Excellence. I'd like to start off by acknowledging AAKP. AAKP is a remarkable organization dedicated to bettering the lives of patients with renal failure. About 10 or 15 years ago, I received an email, I think from Paul Conway, asking me to speak at an AAKP meeting. And at the time, I didn't know who AAKP was. Every single nephrologist that I spoke to said that AAKP stood out as an organization with unimpeachable ethics, unimpeachable commitment to bettering the lives of patients with kidney disease, and that every single person in the leadership at AAKP, Richard, Paul, Ed, Aaron, every single person, Diana, has been touched by the pain of kidney disease, and is committed to making lives better for everyone who's confronted the ugly reality of kidney failure. I'd like to also take a moment to talk about a patient who's really been our lodestar, our North Star, our Polaris, a young man who overcame remarkable barriers, suffered for years, and never lost sight of the goal. Brian Hess is a truly extraordinary voice advocating for patients with renal failure. Never failed to hold our feet to the fire and ask us whether we were doing the right thing, looking for the future, steering in the right direction. AAKP and the Kidney Project have had a long history together. We've spoken at AAKP's Innovation Summits, and AAKP was right there beside us when the Kidney Project was awarded one of the Kidney X prizes in a prize competition to advance technologies to treat renal failure. I speak for everyone on our team, myself, Shuvo Roy, all of the scientists and technicians and engineers who worked with us to move the needle from 50-year-old technology to a new way to treat patients so that every single patient who wants a kidney transplant can experience the benefits of transplant, not through deceased donor donation, but through a device that's mass-produced that can confer the benefits of transplant on every single last patient who wants it. And that's the Kidney Project's implantable artificial kidney. It's an ambitious milestone, but AAKP has stood beside us for over 10 years, pushing forward to try to reach that milestone. AAKP, I salute you for your ethics, your industry, and your effectiveness in advocating for patients with renal disease.